welcome to my channel, Evna Lifestyle. Nakas Evelyn here. Today's story is epiglottitis, also called Akalimi in my country, Zambia. So I'm going to share with you on how it comes about and how you can try to notice, like, okay, this is the thing that is happening to me, right? So epiglottitis, this is just the inflammation of the epiglottis, right? So the epiglottis is just a soft tissue which is found in the neck. So what this tissue does is that as you are eating, it will block the airway or the trachea so that the food will be able to pass without going to the trachea, so that you won't be choked. So that's what it does. So when that epiglottis is inflamed, it will really make one to have difficulties in breathing, and it will make one to even kick the bucket, and by that I mean to die, right? So this is a serious condition. It's a serious medical condition, and it's a life-threatening condition. That's why I want to share with you on how you can know it. When you know it earlier, it will really help one to be cured and to be fine. If you know it the time you're going to know it, when nothing can be done, then obviously that person is going to die. So I want to share with you on how it comes about and how you can know and how it can be treated quickly as possible. It's not really avoided. It's inevitable. Causes epiglottitis, one of them is bacteria. Yes, so the bacteria or the fungi, when it goes or it settles there on the epiglottis, it makes the epiglottis to be inflamed, and when it gets inflamed, it will become big than the way it's supposed to be. So it will become big, it will become reddish in color, and it will be paining at times. So that's how it's going to be. Then the second one, it can be that you're taking, when you take something that is really hot and it reaches where the epiglottis is, it will also make it to be inflamed. Then the other one, it can be any foreign body as you take in, or maybe some chemicals. Maybe when you're smoking, those inhaled chemicals may go on the epiglottis and it gets to be inflamed, right? So these are things that can really make the epiglottis to be inflamed. Okay, so let's do how you can know that this person has epiglottitis. Never ignore these signs. If one has these signs, make sure you try to check them so that they can be helped as quickly as possible, right? So the first one is one who starts having some coughs. In the early stages, one will start feeling like it's a worm which is there, like a tiny worm is there, and it can't go back, it can't come out. So that's one of the biggest sign, and you have to make sure that you check them. So I'll also explain on how you can know as you're checking them, you know that this is what's really happening. Then the second one is coughing. One gets to cough continuously, time after time. So that is when it has even progressed. So one will continue coughing time after time, being uncomfortable. So you don't have to ignore those signs. Then the third one is loss of appetite. One gets to be so stressed, you can't really concentrate to the things that you want, and you can't eat. So that's loss of appetite leads one to lose weight. You're not eating, so obviously that person won't be able to gain weight, right? Then the other thing, one gets to have some sore throat. Since the epiglottis is inflamed, even the other tissues, the surrounding tissues to the epiglottis, will also start having some inflammation. So therefore leading to pain inside of the neck, and then one who gets to be so uncomfortable. Never ignore these signs. Make sure you check them and make sure you know what's really happening to them, right? So let's go to how you can know that this is epiglottitis. So make sure you tell one to open up the mouth. Immediately you see those symptoms, tell them to open up their mouth. When it opens up, or when they open up their mouth, you check the epiglottis there. The normal one, you can check for yourself, like how yours is looking, how yours seems to be. Then you also tell them, you also check their epiglottis, how it is. You compare to them. So epiglottitis will show, or how you're going to know that this is epiglottitis. The epiglottis, the way it is, just there on the tip of the epiglottis, there will be something like a tail, and a tail will be in a colorless color. Then the body of the epiglottis will be so reddish in color than the normal one. Then the tip there, it will be something that will even be able to sweep the tongue. It will be able to reach the tongue. So never ignore that. Once you see that, make sure you rush them to the doctor, to the medical doctor, so that they do some more testings, and they really help, and they really help in removing that, right? So that epiglottis will be sweeping the tongue, and when it grows to be very bigger, it will drop in some saliva inside the trachea, and once it does that, it's the one which leads the person or the victim to be coughing continuously, because the trachea are filled up with fluid which is not supposed to be there. The trachea and the lungs, it's only air which is supposed to be there. So when any tiny fluid, any drop of fluid goes in there, it will make one to be coughing continuously and being so uncomfortable. So never ignore that. Then the step which comes in when they know that that person has epiglottitis, it's either, if it's in the early stages, you'll be given some medications. Then if it's not in the early stages, definitely it will be a surgery on. They'll have to cut it. You don't have to be scared. They have to save your life. So never ignore these signs and never ignore the symptoms. Thank you so much for staying tuned to Evna Lifestyle. Don't forget to subscribe if you are new. Thank you for coming. Don't forget to subscribe and also to leave a comment on this story, how it's going to help you. And also, if there's anyone who has those things, the symptoms that are just from saying, never ignore them. If it's not your first time, thank you so much and welcome back. See you in the next episode.